all. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So the discussion today is the vitamin A toxicity, especially when taking cod liver oil for omega-3s. Cod liver oil is a popular supplement for omega-3 vitamin A and vitamin D. However, there are articles you would read, you can Google them, and you'll see that there are various articles that say that hypervitaminosis A or vitamin A toxicity is a concern when using cod liver oil. So I wanted to make sure that we can look at that. The short of the story is it's really a very high quantity of cod liver oil daily used to have enough vitamin A supplementing on daily basis to end up with toxicity. Number one. Number two, children are a little more sensitive to vitamin A and its toxicity than adults. Now, I think that you would, when I go through the discussion, you would agree that the amounts that can cause toxicity are tremendously large. So we may not actually be using that much, but I'll show you a case where there are some children without any clinical outcomes were eating candies that had vitamin A, and they had very high vitamin A levels in their blood. So with this summary, let's start our discussion. What we will do is the following. We'll look at various references. Then we'll look at a study that would show us that cod liver oil may be superior to simple omega-3 supplementations. And then we would look at the daily RDA for vitamin A, which is present in cod liver oil as well. Now remember, vitamin A is not present in other omega-3 supplements. Then we would look at the amount of, we look at a couple of supplements and the amount of omega-3 present in them and the vitamin A present in them. Then we'll look at what is the possibility of toxicity or not, and we'll look at a couple of case series as well, where some children, one child had a toxicity and then 3 had higher vitamin A levels. So with this, let's start. So first, references. So this is drbeen.com. In the description of this video, there is a link that you can go and get access to drbeen.com at a very reasonable price. Now, if you wanted to have the CMEs, then you can go to plans and have CME packages as well. This is the Office of Dietary Supplements from the NIH, and this is their recommendation chart. This is one of the studies that shows the acute and chronic toxicity. This is another study that shows the regular consumption of cod liver oil is associated with reduced basal and exercise-induced C-reactive protein. This shows the benefit of it. Then here is another article that shows the toxicity of vitamin A in a child after they had been using large quantities of cod liver oil and possibly vitamin A supplements for months and years. And then this is another reference. So with this, now let's go to my drawings and start looking at this together. So first of all, let's look at a study that shows why cod liver oil may be superior to omega-3 simple supplements. So here is a study. It says regular consumption of cod liver oil is associated with reduced basal and exercise-induced C-reactive protein levels, a prospective observational trial. So what they did in this study was they took the athletes, I believe 1,002 athletes, and these athletes were doing 92 kilometers of bicycling, and then they observed which of them had been using omega-3 or not. And then within the omega-3, they were observing who among them were using cod liver oil for omega-3 supplementation or who were using non-cod liver oil omega-3 supplementation. So they separated them. Here total was 1,002, and then they had some of them that were on cod liver oil and others who were on simple supplements for omega-3, and then there were a lot that were not using omega-3s. And what they were doing was they were checking their C-reactive protein. C-reactive protein is a protein that is released when there is inflammation. So what happens is whenever we do rigorous exercises, especially in these athletic bicycling folks, athletes, there will be muscle damage during the exercise. That would then cause inflammation. So athletes take omega-3 and other supplements, but omega-3 is a common one that they take to reduce the inflammations after their rigorous exercises. So that is the discussion that was happening here, or that is the study. So let's go back to the study now. So method, the C-reactive protein concentrations were measured in 1,002 healthy recreational athletes before and 24 hours after a 91-kilometer bicycle race. I believe I said 92, so I said corrected. The use of omega-3 fatty acids supplements was reported in 856 out of 1,002 recreational athletes, and the association between supplements use and the exercise-induced CRP response was assessed. So they took their blood samples before they would do the exercise, and then they take their blood samples 24 hours after they had done the exercise, and they were measuring C-reactive protein, which is an indication of the amount of inflammation present in the body. So here is what they saw. So these were all little bicyclists. So 274 subjects reported regular use of omega-3 fatty acid supplements out of these 1,002. 173 of those used cod liver oil. The remaining, I believe 101 regular users of omega-3 fatty acid supplements had significantly lower, so now regardless of their using cod liver oil or not, but regular uses of omega-3. Regular uses of omega-3 fatty acid supplements had significantly lower basal and exercise-induced CRP levels as compared to non-users. So basal level means that even before they did the exercise, we all would have some CRP, maybe nothing, and that would be the best. But if we have any inflammatory state, then we would have some CRP levels, C-reactive protein levels. So they're saying that the regular users, when compared to others who were not taking omega-3, they had lower basal C-reactive protein. To begin with, they had lesser C-reactive protein in their body. Then they did the exercise, and then they also had lesser CRP compared to other non-users of omega-3. Compared to non-users, regular users had a 27% reduction in natural logarithmic CRP response. Unadjusted model, and 16% reduction after adjusting for age, sex, race, duration, race duration of the bicycle, body mass index, delta creatine kinase. Creatine kinase is produced when our muscles are working, and delta means just the difference between the creatine kinase before the race and after the race. That would tell us how much muscle may have broken down. MET hours per week, restarting heart rate, and higher education. So when they adjusted it, it was 16% reduced CRP on the natural logarithmic scale. But check this out. Those who were taking cod liver oil, CLO users, CLO was the primary driver of this response with a 34% reduction unadjusted and compared to non-users, and corresponding numbers in the adjusted model were 24%. Remember, the other one unadjusted was about 27%. Here, even after adjustment, 24% reduction in C-reactive proteins. This is the cod liver oil users, athletes. This is a beautiful thing. I mean, think about it. Inflammation, less inflammation just with cod liver oil use. Okay, so then the question becomes, what is the problem with the vitamin A toxicity possibility? Why are so many articles talking about it? And there are some, you can see various articles. There was a very popular paper that kind of was looking at vitamin D but said vitamin A toxicity can occur. Then that was refuted by others. So there's a lot of discussion on the internet about this. I'm not going to go in that discussion. I'm going to go into really the measurements and make it more practical for us. So first thing to understand is the daily recommended amount for vitamin A. So here the RAE is the retinol activity equivalence. So I'm going to just request you to look at a few lines here. So children 4 to 8 years, 400 microgram of RAE. And adult males and adult females, 900, 700 microgram RAE. You can see the rest of the chart here, or you can go to the Office of Dietary Supplements on NIH and see the chart over there in vitamin A article. I have these links in the description of this video as well. So 400 microgram and 700 to 900 microgram. Keep that in mind when we go forward. Now the question becomes, vitamin A amount in 1 tablespoon of cod liver oil, how much is that? And how toxic that may become if we take it in large amounts. So it depends upon the supplement. So of course there are some generic statements. For example, you would see in some articles that they would say 1 tablespoon of cod liver oil contains 400 or more than 400% of the daily vitamin A requirement. So for example, if the requirement is 900 microgram, it may contain 3600 or more microgram in 1 tablespoon. So now the second question that would become important is, how many tablespoons are you looking to have? How many servings are you looking to have? And I guess that there are 2 ways to look at that. One is just to look at the supplement facts and just go with how they are recommending it. Or the other one is to you deciding how much DHA and EPA you need, that is omega-3 active forms or more pertinent forms for our body. So here I'm going to give you 2 examples. I have removed their names just so that we can look at them. You can look at other supplements and see the labels. So here the first one, it says total omega-3 417 milligram. Now imagine that we are looking to have 1 gram of omega-3. So 417 milligram is half, right? So lesser than half. So let's say it is 500. So that means we'll have to take double the serving in a day to have about 1 gram. So 2.5 times, right? So here the DHA and EPA, that is here as well. But remember that we are not taking omega-3 separately. We are taking cod liver oil, and here is the vitamin A level here. So if you see here, this is 365 microgram RAE, which is 41% of the daily requirement. I would suggest 41% of the daily requirement may be for women. For men it is 900, and so, or women and men. So it's in that ballpark. So in this case, in this supplement's case, to have 1 gram, let's say we would have to double our dose. That means we take 1 serving in the morning and 1 in the evening, and that would actually get us almost to 100% of the vitamin A requirement. Now if you're taking vitamin A separately as well, or with another vitamin A tablet, so that would then add up. Or if you're taking fruits and vegetables that have vitamin A, then those will add up. That is something to keep in mind. So here, if I am taking this, I would at least like to have 1 gram of the DHA and EPA. That would mean I would have to take two servings, and these 2 servings actually have no harm here, even when I'm taking double the dose, because vitamin A only barely reaches 100% of its requirement. Now here is another one. In this one, if you see, 1 serving size is 5 milliliter or 1 teaspoon, not tablespoon, teaspoon. In this 1 teaspoon, according to the label, there is 1.1 gram of DHA, EPA and DPA. So that's very good. 1 gram, I would like to have 1 gram for myself. You would talk with your doctor and decide what you would like for yourself, if at all, right? Now vitamin A here is 28%, that is 255 microgram RAE. So if I wanted to have 100% of vitamin A over here, I would have to take 3 servings. Or if I was trying to have 3 times the omega-3. For example, there are some studies that show the benefit of omega-3, DHA, and EPA for cardiovascular systems start from 4 gram daily use and above. So let's say I'm going for that, and I need to 4 times this serving. That will mean 1 tablespoon and 1 teaspoon. 3 teaspoons make 1 tablespoon. So here we're talking about 3 teaspoons. We'll have to take 4 servings to make this 4 grams. But that would then, what would happen to vitamin A here? So vitamin A is 28%, so this would become more than 100%. I don't think that is a problem. But don't go with what I think. I'm going to actually show you the math for where the toxicity occurs. This right now is just for us to understand how to look at cod liver oil and how to see if it is going to be a problem or not. Okay, now let's continue. Where is the toxicity? How will the toxicity occur? What is the literature available? So here is refractory hypercalcemia owing to vitamin A toxicity in a 4-year-old boy. This is the one study that I showed you in the beginning where there was a picture of the boy. This is 2020 June 22, and look at this. In the discussion, they write, the authors who handled this patient, the patient ended up in emergency after the vitamin A toxicity. So they wrote, our patient was ingesting 1850 to 3780 international units per kilogram per day, per kilogram. Now, international unit to RAE conversion is that RAE is 1/3 of the international units. So imagine if this was 3000 units, international units, then that would mean 1000 microgram RAE. So here, this is per kilogram, not per day once, but for each kilogram of the body weight of that child, he was taking almost double, or I think triple or 4 times the daily dose for vitamin A. I should actually calculate it right now. So 37 and 80 divided by 3 is about 1300 microgram. Now for this child of 4 years, the recommendation is 400. So the child is actually taking 3 times the amount recommended per kilogram of the body weight. That is how much the child was taking. While children can develop toxicity at lower total doses of preformed vitamin A than those required to cause toxicity in adults, our case is somewhat unusual that in that patient was consuming large quantities of provitamin A from fruits, vegetables, and notably kale. One explanation is that intake of large quantities of provitamin A and preformed vitamin A and cod liver oil supplements together may have caused toxicity, as the effect of high level of preformed vitamin A on the metabolism of provitamin A may be synergistic. So even at this level, they are thinking that the toxicity occurred because he was taking lots of fruits and kale, and also taking cod liver oil, and also taking vitamin A supplementations. This is 4 years old child we're talking about. So then they say, after the patient had spent 2 weeks in hospital, we received the results of the outstanding investigation. His parathyroid hormone related peptide and total vitamin D levels were normal, but the vitamin A levels were significantly elevated at 4.1 of the reference value. Because of this elevated vitamin A level, we carefully reviewed his diet and supplement intake. Now look at this child, 4 years old, taking such a large quantity of vitamin A, and now see it would be over years, more than a year. He was on a predominantly plant-based diet, and we estimated his vitamin A intake to be between 1528 microgram and 3304 microgram of retinol activity equivalent, REA, per day. That is, look, his recommendation per day is 400. And look at this, almost 8.59 times per day is the amount he's taking. You would see it later that acute toxicity for children could occur at 10 times the recommended amount taken daily. Here this child is taking more than 10 times, or almost 10 times, 9 times on daily basis for months. So per day, or 31,000 to 63,000 international units per day. Recommended intake of children at the age of our patient is 400 microgram RAE. We refer to the US Department of Agriculture to provide the levels of vitamin A in the foods and the conversion of factors for RAE and IU from the US National Institute of Health. The patient's main source of vitamin A included 1 to 2 cups of kale, 2 to 3 cups of green vegetables, 2 to 3 cups of fruit, and 4 ounces of meat per day non-liver, plus a multivitamin containing vitamin A as beta carotene. He had previously been taking cod liver oil supplements 276 microgram per day for more than 1 year, but had stopped many months previously. So this is a child who for months and months had been given high doses of vitamin A, including cod liver oil. Now, so after this, here is another, the acute and chronic toxic effects of vitamin A. This is a beautiful article. I would recommend that you read it. This is February 2006. So here they're talking about effect of chronic vitamin A intake on circulating vitamin A and tissue storage. So I'm now moving away from cod liver oil, and I want to show you what is the vitamin A level taken on daily basis that can cause the problem, the toxicity. So acute toxicity, check this out, which occurs when adults and children ingest, adults more than 100 times and children more than 20 times the RDA, respectively, for vitamin A over a period of hours or a few days. So now think about it with me, 100 times. If we go back to those supplements, let's think about the second supplement. If I want to go back, let's say here, this one. This supplement, let's say my target is to take 1 gram per day of DHA and EPA. So this one serving, 5 milliliter, 1 teaspoon is good enough for me per day. And this one has 28% of the daily vitamin A. So if I wanted to make it 100%, that would mean 3 servings. Now, 3 servings is going to give me almost 3 times the cod liver oil I wanted to have. Now, to make it toxic, acute toxic, I have to take 100 times of these 3 servings. So 300 servings or 300 teaspoons every day for a few days or hours will maybe cause vitamin A toxicity. Why would I take 300 teaspoons or 100 tablespoons? Why would I do that? So this is important. Still, the toxicity can occur if somebody is starting to do that on daily basis. But why would I do that? Similarly, if you look at this supplement, this one has, I'm going to make it easy for myself. So let's say half the amount of vitamin A's daily RDA and half gram of omega-3. So to have this one, the servings are 3 soft gel. I want to have 1 gram of omega-3, so I'll double these, so 6 soft gels, which would also double the vitamin A, and that would be 100% of vitamin A needed. Now, if I want to bring it to toxic level, then that would mean I would take this 1 gram, that is 6 capsule or soft gels, and multiply them with 100. So that will become 600 gels on daily basis to be able to reach that toxic level. Acute toxic, that means I take it now and wait for a few hours or days and I get toxicity. Of course, not recommended. I'm just presenting the quantities. And why would somebody take that large a quantity? So back here, 100 times. And for children, 20 times. Children are more sensitive to vitamin A toxicity than adults. Now 20 times, so if they are going to have 400, and then if I go back here once more for you, this one has 400, almost 400 microgram of vitamin A. So this is sufficient for one child's daily requirement. A little less, but the rest can come from the food. For this child to develop acute toxicity here, they would need to take up to 20 times of this one. So this is 3 soft gel multiplied with 20, 60 soft gel daily could create acute toxicity within hours or days. Why would we give 60 soft gel? unless there is an accidental ingestion or child just took it. I'll show you some candies later on in the cases where those would become a problem. Similarly over here, if you see this one has a lot of omega-3 in it, but 1/3 of the daily requirement. Let's call this a daily requirement for a child as well. Or let's double this. So 255, let's say 500. Now that means 5 milliliter or 1 teaspoon has 500, 2 teaspoons have the daily RDA for a child. Now to bring it to the toxicity level, that will mean 20 times. So 2 multiplied with 20, 40 teaspoons, not tablespoon, teaspoons can become toxic. So these are very large quantities. Okay. Now they say that acute toxicity which occurs when adults and children ingest 100 times more or 20 times more than their RDA respectively for vitamin A over a period of hours or a few days is less of a problem than is chronic toxicity from preformed vitamin A. So they're saying that this is kind of lesser dangerous because who's going to take hundreds of tablespoons or teaspoons? So then the chronic problem that you're using it on regular basis. Remember, vitamin A is a storable vitamin. We used to remember this in our medical college, and we would say cat is on the EDIC to remember the fat soluble vitamins. So that is A, D, E, and K. These are all storable. So vitamin A is one of them. So here now the chronic toxicity. Chronic toxicity results from the ingestion of high amounts of preformed vitamin A for months or years. Preformed means the one that is present in the supplements. Daily intake of greater than 25,000 international units for greater than 6 years and 100,000 international units for greater than 6 months are considered toxic. So 100,000 international unit is almost, make it 1/3, and that is the RAE, microgram RAE daily, and then you continue with that for 6 months. So now here this is about 33,000 micrograms. The recommended dose is 900, so that is 33 times the daily recommended dose, and then for 6 months or more can become toxic. So this is the chronic outcomes. But once again, why would somebody want to take 33 times the daily requirement? But there is wide inter-individual variability of the lowest intake required to elicit toxicity. Children are particularly sensitive to vitamin A with daily intake of 1,500 international units per kilogram body weight per kilogram body weight. We reportedly with regard to toxicity. This is weight, body weight. So now 1,500 international units, 1/3 is 500 microgram RAE. A child of 4 years has 400, 4 to 8 years has 400. So let's say 500 is kind of in that range. And then that is per kilogram. So 15 kilogram. So 15 times, and that over months can then lead to toxicity. Similarly, the elderly may be at significantly greater risk of toxicity than our younger adults with a chronic high intake of preformed vitamin A. But the mechanism for this greater risk are not known. Possibilities include reduced chylomicron clearance of vitamin A, increased intestinal absorption of vitamin A, and other nutritional factors such as zinc deficiency, a condition that is common among the elderly individuals. Tolerances to different amount of vitamin A ingested on chronic basis have not been adequately studied. So this is the basic discussion. I now want to show you one more interesting one more case study where there was some preparation over the counter that contained large amounts of vitamin A in candies. And so numerous vitamin supplements are available over the counter to the general public. Some such supplements are available as candy-like chewable preparations to encourage consumption by children. We report 3 cases of overdose of such preparation. Now please remember, when you read overdose over here and you look at this tremendous amount of vitamin A, also keep in mind that they said there was no clinical or biochemical complications noted. So in quantity there was an overdose, but they didn't see a clinical outcome. So here, each patient had taken an estimated 20,000 to 30,000 international units of vitamin A. So over days, so 200,000, I can't believe it, to 300,000. So 1/3 of 300,000 is 100,000 microgram of RAE. Now the child who is supposed to, let's say 3 or 4 days, child is supposed to have 400 microgram RAE per day. 4 days is 1600 microgram, and here the child is taking 100,000 I can't believe this, 100,000 microgram RAE within 3-4 days or 2-3 weeks. And that still did not create, according to the article here, any clinical outcome, but they did have, the children did have higher vitamin A levels. So here, their circulating vitamin A concentrations were monitored over a 6 months period. There were no clinical or biochemical complications noted. However, there were marked increases in both retinol and retinol palmitate concentrations above age-related reference ranges. In particular, it took 1 to 3 weeks for the serum retinol concentrations to peak and many months from them to normalize. Parents should be warned about the dangers of excessive vitamin consumption. Clinicians should be aware of the late peak in serum retinol concentration, which may lead to the complications of vitamin A overdose. So that is the discussion. In summary, it can occur from cod liver oil, but it has to be larger quantities, larger than what you would expect if somebody is doubling their quantity or tripling their quantity. We're talking about 100 times more or 20 times more for children, 100 times more for adults, or 30 times more over 6 months of these supplements to eventually cause toxicity. And I would recommend that nobody takes even 3 or 4 times more. So with this, thank you very much. And please like, subscribe, and share. There are links in the description for these studies and more. Plus, if you would like to support this work, there are links in the description to support it. You can buy me a coffee, you can use PayPal, you can become member of Patreon or Substack, and you can actually become member of Drbeen as well. There is a link with very inexpensive fee. And finally, I am starting a course on inflammation. It will be started from next week. And I think we all should have it. So if you're a member of these, then you can join us. Some of these fees, for example, Drbeen fee here is $5 per month, which is for you only. And you can join that and participate in those as well. Separately, that course is $300 for the course. So with this, thank you very much, and I'll see you the next time. Bye for now.